Greetings. My name is Gary Mefford. I'm a clinical specialist with Hayek Medical. Please stand by for an important message from Professor D.M. Linton. Dr. Linton is a critical care and pulmonary medicine professor, as well as the retired director of medical intensive care unit at Hadassah Hebrew University in Jerusalem, Israel. Dr. Linton has published multiple papers on the use of biphasic cuirass ventilation and critical care in general. He is considered one of the most expert and experienced users of biphasic cuirass ventilation in the world today, and he would like to offer this message to clinical teams in the U.S. Please stand by.
Good evening. My name is David Linton, retired Associate Professor of Anesthesia and Intensive Care at the Hebrew University of Jerusalem, where I worked as Director of the Medical Intensive Care Unit for more than 20 years. During this COVID-19 pandemic, I have heard from my colleagues in intensive care units in Israel and abroad of the terrible situation after intubation and mechanical ventilation, where the patients become more critical and many of them die, the mortality being in the 90%. I believe, as many of my colleagues do, that much earlier intervention with appropriate medication of anti-inflammatories, antivirals, anticoagulants, vitamin support, and appropriate antibiotics for secondary infection, we can prevent a lot of these cases getting so bad. In addition, the administration of additional oxygen by nasal cannula, which can be given at home by an oxygen concentrator, by CPAP or BiPAP, by face mask or by hood, we can improve the oxygenation, we can improve the pulmonary function, and we can buy time while those medications start to work. With this RTX Hayek ventilator, manufactured in the United Kingdom, placed over the anterior chest wall and abdomen, we can do exactly the same by elevating the FRC by continuous negative pressure, recruiting alveoli in the bases and periphery of the lung, improving the ventilation mismatch, and improving the cardiopulmonary interaction. In fact, in many ways, the negative pressure is much more physiological and much better than the positive pressure applied by high flow oxygen, BiPAP or CPAP. With this machine, it's very easy. With an oxygen concentrator at home, to provide nasal cannula oxygen, and then to prevent the spread of the virus, the active particles, by aerosolization, by placing a face mask over the oxygen. Or, if the greater oxygen is needed, by a face mask underneath the surgical mask to protect the environment. I have had good experience with this technology applied at home in various parts of the country for patients who we avoided the admission to hospital and therefore the admission to intensive care unit. I believe that prevention of intensive care is better than intensive care itself, and the more active we can be in the periphery, at homes and in the emergency rooms and the medical wards in providing adequate support and adequate medication, the more chance we'll have of preventing unnecessary intubation and mechanical ventilation.
To all the hard-working respiratory therapists out there, we here at Hayek Medical Devices say thank you.
For your endurance.
For your sacrifices.
For your perseverance.
For making a difference day in and day out.
For saving lives.
One patient at a time during this COVID-19 pandemic.
For your innovative ideas for providing the best patient care.
So that your patients are able to
breathe easier.
For giving 100% while on the job.
To give patients hope.
And a better quality of life.
For your dedication.
For your passion and your determination.
For being essential workers.
On the front lines.
Fighting the COVID-19 pandemic.
From all of us at Hayek Medical,
thank
you.
For more information on BCV, visit www.hayekmedical.com. Follow us on social media and witness how we change patients' lives for the better. To book a live demonstration with our clinical specialist, call 855-243-8228 or email info@hayekmedical.com today. For more information on BCV, visit www.hayekmedical.com.